This is the most important event for us to decide what to do about long-term conditions over the next year, the next 2 years, and probably the next decade.
1 in 3 people in England have at least one long-term condition. 1 in 4 people suffer from a mental health problem, and 4.6 million people have both physical and mental health conditions. One of the key themes of this conference is thinking about how we can meaningfully integrate the two, how people with mental health problems can have their physical health problems properly treated, but also how those with physical health problems can actually have mental health incorporated as an everyday part of their management.
As much as 70% of all activity in inpatients is related to long-term conditions or non-communicable disease. As much as 50% of all activity in primary care is also long-term conditions and non-communicable disease. I think this is an opportunity for us to look really quite critically at the way we do things and to find a way to do things which is far more personalised to the individual who's receiving them. The new healthcare is the healthcare of personalisation.
The number of people with long-term conditions is predicted to rise from 1.9 million to 2.9 million by 2018, and this will put an additional burden, if we don't change the way we deliver care, of up to 5 billion into the system. Please come to the conference. Please help us shape the future of health and care.
This is the time where some of the biggest strategic decisions are going to be taken.
This conference is about us listening to the experiences from the front line, to patients and professionals, so that we can truly support the changes which are so necessary to address this huge agenda.
If you're not at this conference, then you're not part of the future, and if you're not part of the future, what you're doing in the present, basically. So I think if you want to be involved in the future of health and social care, you need to be at this conference.